Hi, I'm Sharon from Buildscope. Today we are at one of the famous clinic in Kuala Lumpur. It is in Mont Kiara area. Let's go. We're going to meet one of the famous and popular aesthetic doctor who is specially for hair treatment. As you can see, this is a reception area. The moment when I come in, it feels so zen. It feels good like you're at home. Let's see whether the doctor is available. Let's check it out. Who is the doctor I'll be meeting? Hi, doctor.
Hi, Sharon. How are you?
I'm good, thank you. Dr. Fu, a very good afternoon to you.
Yes.
And also, I heard that you're one of the very popular aesthetic doctor for hair treatment.
Yes. A brief introduction about myself. I'm Dr. Fu, and I've been in this industry for the past 10 years. I'm a board-certified aesthetic physician with special interest in hair restoration. So we help our patients to not only to restore their hair, in a way, actually, we're helping them to regain back their confidence. We provide different options of regenerative treatments for hair, from medical treatment, injectable treatments, laser treatments, up to transplant. Myself also have been actively involved in a lot of KOL activities as well as the teaching as well. So to me, everyone is having some issue with their hair, and we try our best to make it better for everyone.
There's a lot of questions where we like to ask. That's why I put it up here so that I don't miss it. All these questions are actually from the viewers, from the customer itself. First question, is it normal for a person when they comb their hair and they tend up having a lot of strands of hair on the comb? Is that considered hair loss?
It's very common for us to have 50 to even 100 strands of hair drop every single day. This is part of our skin or hair turnover. As long as, for example, your hair shedding is not accompanied by symptoms such as itchiness, burning, pain, you don't see any obvious thinning patches, you don't see any balding area, you don't see any recession in the hairline, that is considered rather okay. There's symptomatic, there's itchy, burning, pain, and then you notice there's a drastic increase in the amount of shedding. And of course, when you start to see thinning, when you see the skin more, when the hair is going up, this is not normal. So in this warrant a proper consultation with a doctor.
How does a person loses hair? What is the main root cause?
So there are many causes of hair loss. So the commonest one would be, of course, hereditary or we call it genetic. So this is we are born with a gene susceptible to hair loss. This is only one thing, because even if you have a gene, doesn't mean that definitely you will have the end result. So there's a lot of environmental factors that we need to take into consideration as well, such as, for example, beside the genetic part, we have hormonal parts. For example, if you have hormonal imbalance, of course, it makes your hair loss more obvious or even present early. Nutritional is very important. For example, if you're having vitamin D deficiency, iron deficiency, normal thyroid, it can actually speed up the hair loss. Of course, stress level, not enough sleep, so this will actually causing hair loss as well. Medication that you're taking, certain medication can put you at a higher risk of getting hair loss. And then, of course, we are talking about the product that you use as well. Improper product, too much of chemical, and it can give rise to hair loss as well. Healthy lifestyle also is very important. If you're constantly smoking, alcohol, not proper sleep, all this adds up together to make your gene actually express more early and so more severe, causing significant hair loss.
It scares me now is because all the root cause, it happens to almost everyone in this world. So I guess we have to really take care of it. First thing is the lifestyle and the stress level that we are facing at this moment.
Correct.
If there are customers who are over 50s or 60s, is it too late to do this treatment?
It's just a number. Whether the treatment will work or not work is not solely depending on the age factor. Of course, it is one of the factors, but it's not the main factors. So we need to see first, what is the cause of the hair loss? What is the severity of the hair loss? What is your existing medical condition? Even if you are around 50 years old, 60 years old, a little bit senior citizen, but for example, your health status is very good, your scalp condition is good, your thinning is very early. When we do provide treatment to our patients, then the overall result will be very good.
I like this, age is just a number.
Yes.
Because a lot of people will say that, oh, I'm aging now, there's no point of wasting money, there's no point of doing more maintenance, it's no longer in use. So this is not the right way.
Correct.
Alright, if a person is bald, really bald, can the hair regrow again? Is that possibility?
So usually I would classify patient's concern, patient's condition, whether it's a thinning or a balding. Thinning means that the hair follicles are still intact, they are still alive, just that they are weak, they are vulnerable. In such a case, with a simple treatment, some medical treatment, some regenerative treatments, the hair can become normal, almost 80 to 100%. But when balding means that a lot of times it is gone. When it is totally gone, we also need to see the extent. So for example, if there's a small area like the M shape per se, of course we can consider some minor surgery, require hair transplantation to restore the area, become almost close to perfect. In which there's really no more hair follicles, then maybe the current treatment may not be the best for you.
And so far, doctor, have you treated with such cases that have successful recovery?
Okay, yes, we do have a lot of advanced boarding patients really wanting a transformation. Yes, of course, that is possible, provided patients are okay to give a little bit more patience, a little bit more of time. Then in the end, of course, the result will be very promising and also happy for the patient. We need to hold their hand and then go through the journey together. Gradually, we improve with time, getting better and better. Eventually, we reach there.
If it's under your hand, I'm sure Dr. Fu, you will make sure that they will have their dream come true to have happy hair, happy head.
Yeah, that's what we call it. If you have a happy hair, you have a happy head. That means you will feel happy, your mood will be happy, then you have a happy life.
That's true. From a cancer patient, actually, the customer mentioned that she has undergone chemotherapy and fully recovered. Because during chemotherapy or during cancer or any chronic disease, they tend to lose hair very easily and they get very depressed. So after the chemo fully recovered, can they do any of these hair treatments and can the hair be regrowth back?
We do have small group patients who are coming from post-cancer survival because chemotherapeutic drug that actually targets an actively dividing cell, which is including the hair follicles and the tumor cell. So the cure of the tumor cell at the same time the cure of the hair follicles as well. So there are a few things that we need to look into this aspect. First of all, of course, patient needs to be in remission, meaning that the oncologist already declared, completed their cycles of treatments, and then they are now considered remission or cancer-free. This is the right time in which we start our hair treatment. So depending on the type of cancer the patient is suffering, because some cancers are hormone sensitive, some cancers they are not hormone sensitive. To make it short, yes, we do have different treatment options for cancer survivor or post-chemotherapeutic patients. Depending on their appearance and also the type of the cancer, then we can choose accordingly to help them to restore their hair as much as possible.
There's a lot of people that they actually ask for PRP treatment and they mention that PRP gives them a very good result. But is that applicable for everyone?
We do have PRP treatment. PRP stands for platelet-rich plasma, which will take patients' blood, then on the same day we'll process blood to extract out the growth factors and really inject back to the scalp. So this is a very safe treatment because it's all from your own cell, nothing external, nothing artificial. So this is a good point because everyone's lifestyle is different. You're getting your own blood and process. So the quality of the growth factors, the quality of the blood, it all depends on your own. So for example, if you have a very good sleep, good health level, no medical problem, no smoking, no alcohol, so of course the quality of your blood will be good. It's not so easy to get such a perfect candidate in the modern world. Because of this, sometimes the consistency of the result maybe varies from person to person.
Meaning that hair treatment can come with different types of services of the treatments that can help. If you put 5% with the same age, it comes with different shapes. Doctor, with your number of 10 years, how many customers have you treated so far?
So we have more than thousands of patients.
Wow.
Most of them will be hair patients, and we have patients from all over the world, from Australia, from Singapore, from Indonesia, Brunei, and so on. So we choose a treatment that suits your outcome, suits your expectation, suits your logistic.
Doctor, what inspired you to be a hair specialist?
So a lot of people are bothered by hair thinning at a very young age, because in the past hair thinning do not present so early, but nowadays you see hair thinning is getting younger and younger. For example, if you are coming with very thin hair at a very young age, yourself you don't feel confident and it affects your performance as well. I want my patients to feel good inside and outside as well so that they can perform their best. That's why I want to venture into hair treatment for those who are facing hair thinning, especially at a very young age, to regain their confidence so that they can do well in their life.